feeling off no matter how well you eat or train. So you might be optimized on the outside, but what's actually happening in your blood? So in this episode, I have Dr. Ann Truong here talking about how toxins impact your testosterone, your mood, and longevity, and how you can take back control. Let's dive in. Dr. Ann Truong, how are you? And I'm happy we're chatting here. We're already having a great pre-chat. So you have a lot of thoughts and so many. You have a really cool background with Dr. Savage. Actually, I want to start there because he is my host / co-host. Here. But tell me how that all kind of started. That relationship. What do you learn from him?
Wow, he is really my mentor. When I first started learning about hormones, I was like in 2011 or so. When I started learning about sexual health,
Hmm.
I know I need to learn about hormones, and I attended the anti-aging conference, and he was on the big stage talking about it, and he had a workshop. I signed up with him. He taught me everything I know about hormones and anti-aging at that time, and so I really owe it to him a lot. And he remembered me, and we reconnected again. So and I even stopped by his office actually when he was in Chicago. Practicing in Chicago, and stop by his office and see how he runs the office, and really mirror my practice, similar to how he runs his practice as well. So he's a pioneer and anti-aging and hormones and certainly in toxin. Because when we learn about anti-aging, we have to learn about toxin,
Hmm.
and it all goes together, And now, with plasma exchange, it's just the next sensible step for him, and I'm hoping to learn that from him as well too.
Yeah. Well, now you're working with men on their vitality, people with ED, their sexual performance. Just I think it's just their well-being as well. But I guess talk about how what you learned there with hormones, what you're learning now. Yeah, obviously the topic of toxins is everywhere. It's bubbling up even more. I think for good reason because they are everywhere. And then how does it relate to what you're doing? I guess give us the kind of the overview, your thoughts, and then we'll start diving in.
Is toxins everywhere. Unfortunately, we can't avoid it. Even the air we breathe, the food we eat, and the drinks, the water we drink, as well. And you're gonna have to live in a bubble if you can avoid that. Certainly, I mean, I love to eat fish, and I think it was like maybe 10 years ago, I found out I had a lot of toxin like silver,
Mm,
because I like to eat fish, but it wasn't wild caught. I just like to eat a lot of fish, and
yeah.
so I had to detoxify myself for at least like 9 months. Liver detoxification, where I took a bunch of supplements and to cleanse my liver
Mhm.
deeply. That was the only way you can detoxify.
Wow.
Your liver in your body is the filter of the toxin.
Hmm.
And because our body is made of organic material, meaning that it's made out of carbon, organic. So toxin is something that your body is different than your body, and your body senses it, and it sends it to the liver and say, liver, convert it to some form that I can work with in the body, and whatever is left, I'm just gonna go to the kidney, and then get rid of it, or go to your intestine and get rid of that through your stool.
Hmm.
And so the liver does a lot of work, and a lot that's why a lot of us end up with fatty liver. And you hear about cirrhosis, but cirrhosis mainly more with alcohol,
Right.
or I guess scarred liver. But fatty liver is very, very common.
Is that like a toxin driven thing or is overworking, the whole fatty liver?
Overworking,
Yeah.
toxin and overworking.
Mm.
Diabetics have fatty liver, and obesity will have you prone to getting fatty liver as
Yeah.
well. High cholesterol, you will have fatty liver. And in fact, I would tell you this because I do regenerative medicine. So we harvest your own stem cells in your body to put it in an area to restore blood flow. And we can tell who has high cholesterol in their blood, but when we draw their blood out. So we draw their blood out, we put it in a centrifuge and we spin it so we can separate out the red blood cell from the white blood cell from the platelets. And we can tell by the consistency of the blood and their plasma, the color, the consistency, the viscosity of the blood, whether they have high cholesterol or not. And those that have high cholesterol, their color of their blood is not as red,
Mm.
and that the color of their plasma, which is without the red blood cells, is kind of like a very dark yellow.
Ooh, okay.
There are certainly blood difference in your blood if you have high cholesterol and or high blood sugar, which is diabetes
Mm.
as well. Because when you draw when you draw it out, you can literally sometimes see a fatty layer
Oh my
in the
gosh,
blood.
that can't be
Yeah,
good. Oh my God. Okay.
yeah.
Wow. Well, so you're focused there, and I'm curious because you said you learned a lot about hormones from Dr. Savage, but also just your own work with what you're doing. You're doing a lot there with hormones. Like how, like you mentioned toxic, like how do those kind of play together? Is there any relationship, some themes that you're seeing that things that
Right.
we should just be aware of, and maybe there's action steps. Yeah.
Yeah, so toxin create an inflammatory state in your body. So what does inflammatory mean? Inflammation means that it's kind of, I describe it as like the body's on fire. It's
Mm.
not balanced, it's on fire. And what it does is that it creates imbalance. So what it does is that it damages the lining of the blood vessel called the endothelium. So the endothelium is the one cell layer lining that line of your blood vessels. We have 5 miles of blood vessels in our
Wow.
body, okay? And so imagine the lining. It's just a thin film that is like a pipe. Your blood vessel is like a pipe, and it has a thin film. That thin film is lined by the cells called endothelial cells, and those cells are what keep the toxin out from seeping in to through the artery and then through the cells.
Mm.
But however, inflammation and or toxin will damage that layer, which then create like a hole, so that way the toxins seep in through your artery and then eventually to your cells.
Mm.
So your blood vessels are the one that protect you from getting toxin, but the toxin itself damage that cell layer, which then it's almost like you have a wall and you have a hole, and the toxin just go through the hole and it's seeping through our cells, and
Mm.
that's what damages the DNA, damages the mitochondria and the whole working of the cells. So that's what toxins do. Now, how does that relate to sexual health? Well, sexual health for a man, in order for a man to get firm enough for activity, he needs to increase 40 times more blood flow down there
Mm.
compared to a flaccid state. So what that means is that he needs those blood vessels to be good and intact, so that way there's more blood flowing through. So if he has toxin, then those blood vessels will be damaged by the toxin, so it's not going to have enough blood flow
Mm.
flowing through the sexual organ in order for it to be functional. And that's how it affects sexual health, because it affects blood flow, it affects the amount of blood that goes to the end organ. And it's not just a sexual organ, we're talking about our organ
Right.
as well. So it's a cumulative over time. And what you care about is those endothelial cells, because those endothelial cells, if they're damaged, you're prone to getting blood clots. You're prone to getting heart attack, which is blood clot in the heart, right?
Yeah.
You get less decreased blood flow. When you have that decreased blood flow, I mean, blood is life to any organ,
Right. I would
right?
imagine your
So,
brain too. Does it
uh huh.
affect? Yeah. Okay.
Yeah, yeah, well, it will contribute to dementia.
Mm.
Strokes. Strokes is essentially a blood clot in the artery of the brain as well. So it always, but interestingly, for a man, when he has ED, it's a warning sign because the blood vessels in his sexual organ is the smallest in the body
Mm.
compared to anything else. So
Yet
when
it takes the
uh,
40 times still,
yes,
right?
yeah,
So yeah, I guess it is a
exactly.
precursor, right? Like
Yes.
if that's not
So
working.
so it's a precursor. It's a warning sign that he has toxin or inflammation in his body. So it's really Mother Nature's way of saying, "Hey, guy, you're not functioning well. Let's take a look at what's going on with you. So there are four things that affect sexual function: diet, all right. What type of foods? If you're eating processed foods, eating carb or fatty food, and then the second is exercise. If
Mm.
you're not exercising at least 3 times a week, and the third is sleep, adequate sleep, because when you sleep, your body heal physically and mentally. And then the fourth one is stress reduction. And
Mm.
stress also is like a toxin itself because stress also induces endothelial dysfunction and it also lower testosterone as well. So all it's like almost like if you have toxin, it kind of affect every aspect of your body, as in blood flow, hormone
Yeah.
level, and the functioning of the organs.
Well, that's what, yeah, it seems like in relating back to inflammation, because that's kind of where you started. Like that's the body on fire, right? So like
Yeah.
it can't be good for everything inside there if things are hot. I mean, they're burning literally. They're probably bigger, right, than normal, not in the good way, the way that
Uh-huh.
you're trying to
Yeah.
do. But yeah, like how in like is there any repairing that lining that you described? Like, is there any kind of going back or reversing? Have you seen that?
Absolutely. We know that you can do that. You can actually repair that by first of all, removing the toxin, yeah,
There you
because
go.
as we know, there are tests that can be done, blood tests, saliva tests, even stool tests that can measure the toxin that we have in our body, and we can have a lot of toxins. And so that's so objective data. And then the third part, the good part is that you can get rid of that, and that is plasma exchange. It's just essentially taking all the exchanging your plasma, taking all the toxin out, and then putting your good plasma back into you again. So it's all the same thing. It's your blood. It's nobody else's blood. It's just
Mhm.
kind of like a filter, pushing
Right.
it through a filter, taking out the toxin out, and giving your good blood back into you. That's the fastest way and probably more comprehensive way. Now you can do it naturally yourself, but it would take a long time. You would have to detoxify your liver, and that would take supplement and also laxative, and
Mm.
to really cleanse and detoxify
And a long
the
time
liver.
too, right?
It takes about 3 to 9 months. I had to detoxify myself, and it took me 9 months, and
Wow.
with testing to get back to homeostasis again. And but you can also do it by diet. Eating a clean, healthy diet, no processed food. You can
Mm.
eat carb, but I call it Mother Nature's diet. We eat everything the eat everything the earth gave you. Don't eat
Yeah.
anything in a box or bag.
Mm.
And whatever the Mother Earth gave you, eat that, and then get it exercise. Even just
Yeah.
walking, 30 minutes, 3 to 4 times a week is adequate enough. Because when you exercise, it increases your testosterone hormone. For women, same thing, it increases your hormone. But when you exercise, it actually starts to heal that endothelium because your heart starts to beat faster,
More
and
blood flow, right? Like
more
it's
blood flow. You're
uh,
inducing more blood flow as well. And then also, sleep, because sleep is so critical, because when you sleep, that's when the body kind of clean itself.
Mm.
It starts to clean itself and it starts to heal itself. So physical healing starts from 10 p.m. to 2 a.m., where your body kind of goes in, cleans the dirt, and then starts to renewal. And then mental healing from 2 a.m. to 6 a.m. So the
Oh,
latter part
interesting.
of the sleep. Yeah. So you ever
Wow.
notice if you don't have good sleep, especially around early morning hours, you're foggy, you're
Yeah.
not as
Mentally,
clear
yeah.
in
Uh-huh.
thought. Yeah. You're
Yeah.
not as clear in thought. So the mental clarity is at between the 2 to 6 a.m.
Wow.
Yeah.
I wonder if that's a
Yeah.
survival thing. It's like, okay, protect the body first, like the
Yeah.
functions, our heart and all that, but then the brain comes kind of second. Uh,
Yeah, because most people can kind of function when they have poor sleep, but they can still function. But if you don't have, if you don't sleep at all, then you're just like,
you're out of it.
you're confused, right?
Yeah.
Yeah. So you
Yeah.
have to sleep. That's why sleep is important. And then the stress reduction,
Right.
like I
Let's talk about
mentioned
that.
earlier. Yeah.
Yeah.
Yeah. So the with the stress reduction, it will also you reduce the stress that will reduce cortisol. Then if cortisol is reduced, thyroid hormone increases, testosterone increase, and all the sex hormone increase, and the body's less inflamed.
Okay, so just
Yeah.
naturally, yeah, reducing the cortisol, and all these other better things are happening. Yeah, testosterone
Uh-huh.
increases. Yeah, and that
Yeah,
goes for women as
testosterone
well.
increase. Yep, and so is thyroid. Kind of like the cortisol is the big driver. It kind of
Mhm.
controls the other hormone as well, and the other hormone kind of react to it. So hormones is it's a seesaw. It's a balancing act in your body, and it's also a feedback loop. And just those four things that I mentioned, you can work with on it, but get testing so you know what's working or not, or just get plasma exchange. It's a faster way of getting the toxin out and getting your and then reinfusing your good plasma back into your body, and it
Right.
can stay for years on end.
After this whole journey, what I really learned here is like there are a lot of health conscious people. I think I'm considering myself one as well. Uh, but no, there's a lot of things. No matter what you do, how much you pay attention to it, how much you avoid it, and sometimes it just got in. And I think TPE gave me a good opportunity to uh, restart my body again.
So let's talk about that because you've obviously done some detoxing yourself, and you've done the toxin testing as well, at least multiple times. It sounds like I've done
Yeah.
that as well. So it's like you know your baseline, right?
Mm-hmm.
And you say you work with a lot of men on helping with the hormones and all these other things, but it's almost like if you don't get rid of the toxins, that piece in the middle there, then you're never going to get the perfect results, right? That you're really looking for at the end. So addressing the toxin burden in our bodies, however level that is, seems like it's like target that, but like figure out a strategy there and then optimize, right?
Absolutely. So that's why I'm really excited about plasma exchange because we're good at optimizing with hormones and with peptides and with
Hmm.
diet and with exercise. We're good at putting the good stuff in, but we're not that great at taking out the bad stuff other than watching what we eat, right? I mean,
Yeah.
that's about it, watching what we eat and sleep and exercise. That's really all we have, and supplement that all the stuff the detox supplement does is really cleanse the liver. It
Mm.
goes in cleanse, so it just dumps stuff out, through through your kidney, you urinate, or through your intestine. So that's the only way you can kind of get things out, but sometimes that's not 100% either.
Hmm.
And that's all depends upon how your liver is working. And I would tell you, the toxin, the detoxification regimen is a lot of pills.
Yeah. I've seen that. Yeah. Yeah.
Yeah, it's about 25 pills a day
Wow.
that you have to take for months on end. But that was years ago I did that, and there wasn't any other option. And so, but now, we have options now, and the key is this. The key is that the more toxin you have, the more inflammation you have, and that's going to affect longevity. It's going to affect your health, because now we're living longer, and
Mm.
we want to live with better quality of life, and better quality of life, better even sexual health. I believe that that you can have sexual health to the day you die, by controlling toxin, by optimizing your diet, your exercise, and your hormones, and by doing that, then you can really have true wellness and health and longevity.
And like, I know what you see men primarily, or I think exclusively, but a lot of this, like you said, translates to women as well, right? Like, I mean, women have testosterone as well. We're all dealing with toxins, inflammation. So, like, is there anything that you would say to women specifically that might be different potentially?
Yeah, well, interestingly, yes, yes, I would have to say, out of the women, we have to worry about three different hormones. Men, you just have to worry about one, testosterone. Okay, but
Yeah.
women, we have testosterone, we have estrogen, and we have progesterone. Three hormones,
Mm.
and estrogen and progesterone is responsible for pregnancy, right? The balance between those, pregnancy and a menstrual cycle.
Mhm.
Testosterone help with sexual drive, muscle, bone health. But believe it or not, women have more testosterone in their body than estrogen,
Mm.
right? And but women only have 1/100 of the amount of testosterone compared to a man. A man
Wow.
has 100 times more testosterone than a woman, and conversely, women have 100 times more estrogen than a man.
Mm.
And but women, out of the three, testosterone is more than estrogen. So I want to clarify that. All right, and so. Whatever we talked about for men is applicable for women as well too.
Yep.
It's just that women, you just have to be concerned between balancing the three hormones together. And then sometimes when you're working with women that still have the uterus, in balancing the hormones is tricky, because if you do too much, they may have their menstrual cycle again, or mess up their menstrual
And it's, yeah.
cycle, right? And so it can be kind of challenging. Like that is easier if a woman has a hysterectomy in controlling her hormones. But everything that we talk about is it's applicable for women as well too. And one of the things I wanted to say is that estrogen is actually considered a catabolic hormone.
What's that?
So what do I mean by catabolic? That it's inflammatory.
Ah,
It's an
uh-huh.
inflammatory, and that testosterone is considered anabolic. Anabolic means growth, regeneration.
Mm.
Catabolic means breakdown, degradation.
Got
And so between the two, that's why you want to optimize more of the testosterone. So most women will come and see me for hormones. Like, oh, I don't care about testosterone. I don't care about libido. We're not doing hanky panky anyway, because my husband got issues. But I said, no, you need your testosterone. You need your testosterone to protect your bone, protect your muscle. It's not just about sex,
yeah.
as well too. You need it as an anabolic, meaning it's protective. It's help growth, it help renewal, it help rejuvenation.
Yeah.
So I'm all about maximizing that for women. It's not about sex. So when I explain that to them, they go, oh, "Okay, that makes sense. Why I need all three."
Maybe sex isn't the thing that people are like, oh, I need to optimize for that. But so what would you say to those folks? And let's maybe the men, yeah, as it goes to, I think of blood flow and all the other good things that we all need. But like, what do you help people optimize for? Let's just say that, because like you're doing a lot of different protocols. I know.
Hmm. Yeah. Well, I help them optimize for living the best quality of life you can as you age.
Hmm.
And so, because now we have the technology now and the medication to keep people alive longer and longer. But do you want to as you get older, you want to be able to maintain your physiological health to even be better than your biological health, right? Your
Mm.
age.
Yeah.
And so you want your physiological health to be younger than your biological age. And there is actually a test for that. Actually,
What's
there
that
is,
called?
yeah, there is a test for that.
Yeah.
There is a test for that to look at the blood test, and also a test you can mess with your hand. I attended a conference, and there is a test for that. And I'm 8 years. My physiological age is 8 years younger than my biological age.
Good. Great. Yeah.
So I must be doing something right. But so my point is that it's not about just sexual wellness. It's about wellness and health. There are two things for sure in life. We're gonna be born and we're gonna die. Right?
Right.
You may
Yeah.
fall in love, may not fall in love, but you're gonna be born and you're gonna die. So we want to be able to have longevity, a longer lifespan with a good health. So that way, what we all want to do is, you can control how you die by how well you live. Because
Mm.
people that are healthy, when they pass away very quickly. They pass away
Interesting.
in their sleep. Yeah,
Really?
they don't
That's
pass
that's a
away.
that's a common
Yeah,
thing. Oh.
yeah. So if you are healthy, like you may just go to sleep at 100 years old and just pass away. If you get sick, you pass away very quickly within a few weeks or within a month. There's no lingering over
Wow.
months to years. There's no nursing home. There's no any of that. And I see that all the time because I used to work in a nursing home
Mm.
as well in my early years. And I can tell you, the one down in nursing home, the one that didn't really take care of themselves when they were younger,
Mm.
and their body is slowly dying, but
Interesting.
not gone. But when you are healthy, and you take care of yourself, your body is just gonna go. Well, I think I've reached my maximum. I'm gonna go, but you go quickly. And
Mm.
I see that all the time. So you can control how you die. But one thing you don't can control is that whether you have cancer or not, right? So if the cancer is a totally different thing. But again, if you are healthy, you are more resilient to cancer.
Mm.
You're more resilient to treatment, and be able to bounce back or be able to tolerate more treatment as well too. So that's the tip that I tell my patient is that you can control how you die by how you live.
That's impactful right there. I've never heard that, but it
Oh,
makes perfect
really?
sense. Yeah.
Yeah, yeah.
And you,
I see it all the time. Yeah, I have a patient right now that's 98 years old. She's very healthy. She's very healthy, cognitively very sharp. Just her bones are wearing down a little bit, and she still live by herself. Still drive her car.
oh my
Still go
gosh.
grocery shopping by herself.
Wow.
Yeah.
Wow. Good for her. That's incredible. And that's the thing. I mean, and I'm sure genetics play into this as well. There's like we were talking about, everyone's different, right? At the DNA level as well. Um, but at the same
Now,
time,
I do want to preface it that genetic,
yeah.
it's only the bullet is loaded in the gun. What
Uh-huh.
you do with your lifestyle is what's gonna pull the trigger.
Got
So
it.
genetic doesn't mean that you're stuck in it. I mean, you may have a family history of Alzheimer, you have a family history of stroke, a family history of heart disease. But however, genetic combined with lifestyle, then that create the outcome. So it's just a bullet
Mm,
and the gun, but what you do with your life will actually change that expression.
yeah. I mean, that's so metaphoric for so many things. Like we all have the bullet, but it's like, what do you choose to do? It's really our choice. Because all the
Yeah.
way to like what you said, the four, the sleep, the diet, the stress, the exercise, the toxins that we all know that are around us or in us. So what are we choosing to do with all that stuff? Dr. Ann, is there anything that is maybe like something that surprised you recently with any of these topics that you feel like we haven't covered here that you just want to you want to share? Maybe it's something that you're fascinated with, you're starting to tell your patients.
Well, I'm really excited about plasma exchange. Really, I think this is going to be a game changer, honestly, because there's never been a way for us to totally detoxify our blood.
You never seen
Uh,
any
no,
other
I haven't
wow.
seen anything like that at all.
It's crazy.
And when I met when I saw Dr. Chapman, he was telling me about it. Makes perfect sense.
Hmm.
And if you're in the anti-aging world for a long time, you are very familiar with toxin or inflammation. And it just makes sense to me how it works. And I just hope that it become more available, more accessible. And I really truly believe once that it is, we'll probably live up to 200 years
Mm,
if that is the case. I think that a longevity, living to a couple of hundred years, even beyond, really depends upon how we get rid of toxin in our body because it's an invisible infection. Almost like an infection, it's invisible. We don't feel it. Like sometimes even getting a headache, it's a sign that you have toxin,
mm-hmm.
right?
Yeah.
Anxiety, depression, as well, right? Obesity,
Yeah.
even trouble losing weight, it's a sign that you have toxin. Insomnia, an inability to sleep, it's a sign that you have toxin as well. All of us have toxin, and that's not even counting the modes, that you're exposed to and all that. All
Yeah.
of us are. You would literally have to live in a bubble for the rest of your life if you don't have toxin. We just don't know how much it is, and then on top of that, adding lifestyle,
Mm,
your diet, your exercise, and sleep, and your stress. On top of that, it's just a boiling, pot that
yeah.
just keep on, creating this negative inflammatory systemic effect in your body.
Yeah, it just makes sense. If we just keep up with the same habits or lifestyle, whatever it is that we're so used to, if we're not feeling what's actually happening inside of us or have the data from doing a test, however you do the test, then you really don't know what's going to happen. It's just going to spill over. Something's going to creep up on you in some way. Who knows what? It can in so many different forms, but it makes perfect sense. And I mean, when I had my test done, I was like, oh wow, this is enlightening. It was almost like a okay, now I know I could do something about it kind of
Yeah.
moment. Whereas I know before, like a lot of times it was not possible. Like TPE not being around or just any other procedures that protocols, but.
Yeah, no, I think that once we know what we need to do, I think that that's going to be a game changer,
Yeah.
for how we live our life. And for you, you already know that you need to get plasma exchange.
Getting
Uh,
it scheduled. Yeah, it's true. Well, Dr. Ant, so like I want to point people to what you're doing because I know you're always up to really fun stuff, cool stuff. I mean, we've chatted a lot, personally, but your YouTube channel is awesome. Can you point people to some of the places they could follow along and reach out to you?
Sure, sure. So you can find me on YouTube at Truong Rehabilitation Center. My last name is Truong, where I teach you everything you need to know about sexual health and how to have sexual longevity. And honestly, if you watch all those videos, you're gonna have the step by step on how to do that. And we have seen comments that people are seeing a difference with just instituting one or two things that we recommended. They have seen like a difference and saved many, many marriages. And also, our website is at truongrehab.com, TRUONGREHAB.com is where you can find out all the services that we have to help with sexual health. But we not only work with men, we also work with women as well, because I feel that sexual health is integral to general health and integral for relationship, which are the three most important thing in this world for us at this point. And also, I think I have, I like to give viewers a recipe for our Good Morning Wood
Okay,
smoothie. Yes,
let's do it.
Good Morning Wood smoothie is full of antioxidant. It's actually detoxifying, full of antioxidant as well. Very easy to make. And you can go to URL goodmorningwoodsmoothie.com to get the recipe.
Beautiful.
And you can buy that in the grocery store, put it in a blender. You can add your favorite liquid. But we have seen this work in men and women in just giving more energy, increasing blood flow, and even just mental focus as well too.
I
So
was
check
gonna.
that out.
I will, and that's great to hear women can benefit from it too. So, yeah, goodmorningwoodsmoothie.com.
Yep.
Awesome. Thank you so much. I mean, I always have a blast chatting with you, and this was like a whole nother angle here. So appreciate you, and I'm gonna go dive into some more of your YouTube videos because always learn something new. So,
Thank you
thank
so
you.
much for having me on this
Of course.
podcast.